Welcome everyone. Thank you for joining us in today's panel webinar, Returning to Work for People with Disabilities in COVID-19. My name is Yusra Benjeloun, Administrative Coordinator and Project Manager with the Work Wellness Institute, and I'll be co-moderating today's webinar. We would like to thank our academic team and our 9 founding partner organizations in the Harnessing Talent project. Harnessing Talent Alliance for Recruiting and Retaining Canadians with Disabilities and Mental Health Challenges is a 3-year project funded by Employment and Social Development Canada. This webinar is made possible through the support of ESDC, as well as donations and memberships to WWI. We thank our advisory committee and speakers who contribute to this webinar series. So while we're waiting for others to join us, I'll go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you may be experiencing, any comments you may have, and any questions related to the webinar. We will collect questions submitted throughout the webinar and follow it with a Q&A based on the questions submitted. We are very excited to welcome our panel experts, Dr. Lucy Kotsum, Dr. Arif Jeddah, and Steve Mantis. Also with us today, Maureen Han, who will be introducing our panelists shortly and will be running the Q&A session. Maureen is the President and CEO of Canadian Council on Rehabilitation and Work, CCRW. CCRW focuses on supporting job seekers with disabilities and employers across Canada. Thank you all for making the time to talk about this timely and extremely important topic. Maureen, I will hand it over to you.
Thank you so much, Yusra. It's wonderful to hear your voice, and it's great to be here. So it's my great pleasure to introduce our panelists today. Our first panelist is Lucy Kotsum. Dr. Lucy Kotsum is an associate professor in the Department of Psychology at St. Mary's University. Dr. Kotsum has a systems approach in her research on work accessibility, linking science, policy, and practice in her projects. Her most recent work with provincial government, business, and academic partners, she is building the Job Access Management web application, the JAM app, an online tool designed to facilitate accessibility communication between workers and management in workplaces of all sizes, from small businesses to corporations. Dr. Kotsum's passion for building evidence-based tools for accessible workplaces is informed by her own insights as a professor with a disability. Our next speaker will be Arif Jeddah. I hope I'm pronouncing your last name correctly, Arif. Dr. Arif Jeddah is a scientist at the Institute for Work and Health. He is also an associate professor at the University of Toronto's Dalai Lama School of Public Health. Dr. Jeddah's program of research aims at understanding how the future of work will affect the employment participation of people living with chronic disabling conditions across the life course. He is specifically interested in understanding early labor market experiences of millennial young adults and their impact on key transitions across life. Dr. Jeddah's research takes a systems perspective to understand the role of policy level factors and organizational conditions in the prevention and management of work disability. And our last speaker is Steve Mantis. Steve was injured in an industrial accident in 1978, losing his left arm. He went through the WCB system and saw firsthand how it failed for so many injured workers. In 1984, he helped found the Thunder Bay and District Injured Workers Support Group, and he's been active ever since, working to improve the lives of injured workers and disabled workers across Canada, both through increasing the awareness of the barriers that many disabled workers face and ongoing self-help groups to address those barriers. He's presently the chair of the Research Action Committee of the Ontario Network of Injured Workers Groups. So I welcome our panelists, and just to lay the groundwork, I've been asked to go over a few slides just to set the stage for where we are at with returning to work for people with disabilities during COVID-19. So if we can go to the next slide. What we know about job loss in COVID-19 and what to expect is that 12.4% of Canadian paid workers aged 15 to 64 have been laid off on a monthly basis since February 2020. And during the last 3 recessions, about almost half, 45% of all temporary laid off workers were permanently laid off. And again, during these recessions, 15% of the remaining temporary laid off workers lost their job the following year. This is according, of course, to Stats Can. In the next slide, we're going to just quickly look at, and I'm sure that this will be available to you, but if we look at the labor market turn down, we can see overall from February to March, and then from March to April 2020, there was an overall turn down of 12.4. And those are average monthly layoff rates, which is a huge percentage, especially when you look at years before and recessions before this. You'll see, I think of note and of interest is that it's the younger age group that is really having this impacted the most at 25.1% for those aged 15 to 24. That, which I think we can all agree that that's a huge number. And then the other very interesting piece to intertwine with this is that the tenure with the employer of less than 2 years is the hardest hit as well, at 17.7%. So keeping all of this in mind, I think we're going to, I'll push it over now to Dr. Coatsum to lead us off in her presentation to help us understand job loss during COVID-19. Over to you. Thank you.
Thanks so much, Maureen. And as I get organized here, I want to thank the Work Wellness Institute as well for this invitation. I look forward to our conversation today. Okay, here we go. All right, so that's me. You'll notice that I don't have an image, I don't have video on today, but I did want to share an image with you of me and also contact info. The slides will be available on the website after. So I think a lot of us can relate to this Instagram post. Zoom really needs a button that plays wrap it up music like they do at the Oscars. So this Instagram joke was just a play on how much we're spending time on Zoom these days, if this is our if that's the accessibility accommodation we need for doing our work. So working during COVID, the good. Well, accessibility for everyone is in the spotlight now. We have, depending on our jobs, we may find that we have more flexibility and control over our schedule. And workplaces and workers are really rising to the occasion, and we have opportunity for innovation. And some of the quotations I'm going to present to you are from my lab's work adjustments during COVID-19 survey. So these are all quotations from workers with disabilities. So the first quotation, we originally found ways to adjust, provided feedback to management, who found ways to support us. It's been a bilateral and collaborative endeavor. And in terms of innovation, a suggestion, using video production instead of live chat to communicate complex instructions to clients would be good. Working during COVID, the bad. Well, it's stressful. We've had drastic and sudden changes in ways of working. And if we are fortunate enough to be working, if we're fortunate enough to not have been laid off or lost our job. We have simultaneously competing demands across all of our social roles, so worker, parent, child, caregiver, and these demands are not just competing as they normally do for our linear time, but they're competing at the exact same time. And so negotiating that, figuring out how to work that is, well, actually, at times impossible, really. Communications between staff and management are challenging. Now we have, barriers. We can't simply pop into the office and meet and talk. All of our communication is, a lot of our communication is mediated through technology. And also simply loneliness. So a comment, in-person interactions would make the job more interesting. And some of us can relate to this image in triplicate of an empty desk and an empty chair in an empty cubicle. Working during COVID, the ugly. So for folks with disabilities, they're subjected to ableist microaggressions regularly. So assumptions that disability means a lack of competence or not quite enough competence for a particular task. Ableist microaggressions might be doubting the need for any kind of adjustment to the work or workplace, because perhaps your disability is invisible. And so that doubt is an invalidation, and it's a challenge to the disabled person's dignity. The ugly, breakdowns in communication. When we're stressed, we're not our best selves. We are irritable. We are reactive, especially with the pressure to, get things operational again. There's a lot of pressure to do things quickly, not to take just a little bit of time to figure things out and to check in with our emotions about things. And all of us as workers, as managers, depending on how we're coping with this, the intensity of COVID, breakdowns in communication happen when we're all reacting. And one of the ugly things too is the inaccessible COVID-19 workplace response. And here's a quotation: "I wish employers better understood that communicating to get a job done due to ability challenges is not supported well via online means." This is a quotation from someone who had communication challenges with their supervisor, and there didn't seem to be any flexibility in terms of how to set up communications in a way that worked. This is an image of the a hallway in the Department of Justice in the federal in Ottawa. I'm not sure if you can tell which way the arrows go. You sort of can. You can see the red arrows a little bit on the floor. And if we think of the way traffic moves on the road, the arrows seem to be in the opposite direction to the way traffic moves. So it's a little confusing. So if I were to approach this situation, I would probably just automatically assume to flow with how traffic might flow, right side. Imagine you're a person with low vision. Imagine if you're a person who uses the assistance of a guide dog. They can't see the arrows. They're not visible. There's no physical way that a person with low vision or no vision can navigate this without a heads up, without a map ahead of time relayed to them by a manager of how to navigate to their office, or an improved setup right from the get-go, accessible design right from the get-go. And the issue of masks. There are a few people for whom mask wearing is very challenging. So not a huge chunk of the population, nope, but for a proportion, it's challenging. For myself, I have anxiety. I have clinical anxiety, and for me, wearing a mask is challenging. I've found ways to make it better. I have found a mask that, you know, and not all masks are the same. They're not all made the same way. Some are better than others. I have the good fortune that I can work from home most of the time, so I don't have to wear one if I'm ever out in public. I certainly do. And there, you know, there's certain strategies, but some people can't. And the incivility to aggression about mask wearing, I'm sure all of us have seen or read or heard those memes vilifying people for not wearing masks. Now, of course, of course, we should all be wearing masks if we can. Absolutely, absolutely. But to suggest that someone not wearing a mask, the assumption being that they are somehow vilified, this is something that makes it very difficult for someone who, you know, can wear a mask, but perhaps for shorter periods of time. It makes it very difficult for discussion. The prejudice makes it very difficult for discussion between the manager and the worker. And then there's working during COVID, the adjustment. Well, it's just the adjustment. It's not the good, the bad, the ugly. It's just what functionally happened. I had to wait to get things set up correctly to work from home, ensuring I had all of the software programs and instruments I would need to get the job done at home. So that kind of setup, yeah, there was a waiting period, and then all the necessary ingredients to get the tasks done were put in place. So here's some tips, work adjustment tips for workers and managers. Find ways to communicate that work. For example, as you can see, I don't use video. That's my preference. That's how I teach, and that's how I meet with students in my job as a professor. And video is really reserved for matters outside work. Now, I didn't need a medical to ask permission to be able to do that. It's just something I can do. It may be a little bit awkward to not be able to see a head that's moving while I'm talking. Sometimes I'm able to just put a photo up, and that's great, and sometimes not, like here. But find ways that work. Psychologically too, by the way, video, to see lots of different stimuli is actually really taxing. So it's also taxing on bandwidth, but it's very taxing psychologically. So sometimes I really just find it easier to think when I'm not paying attention to video and audio at the same time. Focus on tasks, the stuff that needs to be done. And that goes for workers and managers. So don't assume what should be done, or assume that, you know, the manager should be doing this, so why aren't they? Or the worker should be doing that, why aren't they? Well, list them out. What are the things? And don't base, especially for people with disabilities, don't assume anything about the person with a disability. Don't assume they can't, and don't assume they can. Simply ask, just like you would other workers. And also be open to a variety of strategies for getting tasks done. These are all things we're learning during COVID, right? We're open to a variety of ways of getting the old, same old is not possible for us right now. One other thing I've noticed is the issue of unions. Sometimes collective agreements are cited as a barrier So as a, management's hands are tied, they can't give this extra consideration or benefit because the union, there's a collective agreement and we'll have to get that in the next round of bargaining. Well, accessibility doesn't work that way. And unions, really, their primary objective is to represent members so they can do their work. And I always encourage managers and employees check in with the union and ask. There may not be a process. Oftentimes, exceptions, not exceptions, but something extra, something that, like an accommodation that may appear to be something extra for an employee. Well, first of all, it's a medically it's a need. It's a valid need to get the job done. But collective agreements can give more to employees. It's a guarantee of a minimum, not a maximum. Anyways, ask the union, and waivers can also be considered. Exceptions. The unions give waivers all the time, and they do tend to give waivers for hiring outside the protocol. That's done. So in terms of accessibility, I don't see why it can't be done too. And suggested simple meeting agenda points for checking in with each other. What's working? What could be better? This is based on appreciative inquiry and appreciative management, and a positive way to identify things that could be better, instead of focusing on deficits. This sucks, this doesn't work. Well, okay, so what is working and what are your recommendations for making it better? And this is for both workers and managers when they check in with each other. And I suggest take notes, take notes. Improve your workplace policies for accessibility. The accessibility standards will be coming, and you'll be so much more prepared, knowing how your organization can make these things happen. And I just want to end on a couple of slides. So the idea of remote work. You see these little houses on the left with remote workers, one worker per house. And then you see on the right a couple of businesses. One is a large business on the extreme right, and then one it might be a small business in the middle. And you see people are working, they're collaborating. You see the 3 remote workers are facing the companies or the businesses. This is working in isolation. So what I'm excited about is that COVID is making all sorts of opportunities for accessibility. Now suddenly everybody needs accessibility, right? Well, everybody always needed accessibility, but now it's the majority that there are barriers to getting jobs done right now because of COVID. What I'm worried about is, and what I want managers to keep in mind, and workers and companies to keep in mind, is that we've worked very hard for inclusion of people with disabilities in the workplace. So yes, working from home is really wonderful for a lot of people. It can help, productivity, concentration, all sorts of stuff. But what I don't want to see is the working from home model to be used as a way to isolate. So when a worker communicates to you that it's actually no longer working and they'd like to, when people are coming back to the workplace, they get to come back to the workplace too, if that works best for them. And I just wanted to end with my slide. Our study is still ongoing. It's available at the jobaccesslab.ca. And this is our COVID-19 work adjustments study. Thanks so much.
Thank you so much. There we go. Thank you so much, Dr. Coatsum. And now we're going to go over to Dr. Jetta.
Hi, everyone. Thank you, Lucy, for a fantastic presentation. I think you really brought a lot of color to this conversation that we're all really interested in right now. So I'm going to start by presenting some data that we've collected over several studies that I'm leading at the Institute for Work and Health in Toronto. And they all kind of hinge on this overarching principle, which really draws emphasis on the role of the workplace and the importance of formal and informal modifications and accommodations as being paramount for the sustained employment of people with disabilities. And of course, the COVID-19 pandemic has created new challenges and opportunities for people with disabilities across all age ranges. So to start off, I'm going to give some preliminary findings of a longitudinal survey of a cohort of over 300 youth and young adults living with rheumatic conditions, a population that I work quite closely with. And as part of this survey, we assessed work experiences as well as access to workplace supports. And so this survey was actually ongoing over the last 2 years and provides a really great understanding of how accommodation need and use was affected by the pandemic. So let's maybe take a first jump into what things looked like before the pandemic. So as part of the survey, we asked participants about the workplace supports they needed. And before the COVID-19 pandemic, participants reported requiring a range of workplace supports, such as extended health benefits, soft accommodations like flexible scheduling, and hard accommodations like adaptations to their workspace. And it's also important to note, pre-pandemic, that 2/3 of participants in this specific study reported needing a work-from-home arrangement. We also asked about the extent to which workplace supports that were needed were actually used. And so those who reported that their needs exceeded the use of a specific workplace support were categorized as having unmet need. And results from our survey showed that over 1/2 of participants reported having unmet need within their working experiences. I think what's also interesting to note is that around 15% indicated that their needs were exceeded by their employer, suggesting that they were working in a highly supportive work environment. So again, this is the pre-COVID-19 pandemic perspective. So the next question we can ask is, how did the findings change when participants were interviewed in the spring following lockdown orders? Well, while the need for the types of workplace supports remained pretty consistent across those pre and post pandemic, there were some differences to note. In particular, participants indicated needing modified job duties. Fewer participants indicated needing modified job duties, informal work arrangements, or opportunities to modify their health at work. Also, fewer participants reported needing structural changes to the workplace, like an accessible workstation. And so it might be that the availability of a work from home arrangement could address some of these specific concerns that people with disabling health conditions could face. And as a result, fewer supports might be needed. But it's also important to acknowledge that these types of accommodations aren't available to all types of workers, especially those working in precarious situations or those who might not be able to access a work from home arrangement where they can make their own adaptations or accommodations. Moving forward, when comparing the pre-pandemic work environment to the post-pandemic work environment, we found that an increased proportion of participants indicated unmet workplace support needs. And these findings suggest that in a post-pandemic world, workplace support needs exceed their availability. Perhaps this could be related to a shift in work from home arrangements, or because budgets are now being shifted to address COVID-19 and safety protocols rather than accessibility needs or making sure that people's accommodations and modifications are met. So in addition to this study that I'm presenting on, I'd like to also present a finding from a qualitative study that we also just completed data collection on. And in the study, we asked young people, again, with different disabilities about their thoughts on the way the COVID-19 pandemic impacted their current and their future perspectives on their employment. And many of the participants we talked about the pros and cons of the changes made by employers to address COVID-19 related safety concerns. In particular, a lot of participants in this specific qualitative study reflected on work from home arrangements. And in many cases, participants were happy to know that this type of work arrangement could now be more commonplace. At the same time, many of the young people we talked to reflected on past experiences where they may have been excluded from work because of their requests for a work from home arrangement. So really there's this level of resent that while it's great that now this is being provided, there's a reflection on past exclusion, which is something of interest to note that popped up quite a bit in this specific qualitative study. And so moving forward, we don't actually have solid data on the impact of COVID-19 on the emerging barriers that people with disabilities may experience to accessing workplace supports or navigating changes in this new normal. But we can look to previous research as a starting point to help us move forward in this discourse. So in a recently published survey, and so this is now another study, we asked about 150 young people living with different disabilities about the barriers they face or they perceived to face in accessing job accommodations in the school to work transition. And some of the most frequently described barriers to accessing workplace supports in this pre-COVID-19 pandemic world related to difficulties communicating their needs at work or disclosing their health condition, the perceived cost of accommodation, feeling like their work tasks could not be accommodated, as well as attitudinal issues held by others in the workplace. So indeed, the COVID-19 pandemic has likely exacerbated some of these barriers to accessing workplace supports, while it might have addressed others. However, the experience of workplace supports or accessing workplace supports following COVID-19 depends on the characteristics of the work environment. So for instance, the need to talk about your health, which is frequently discussed as a barrier to accessing workplace supports, might be reduced if you're working at a job where work from home arrangements are made and you can now take more control over your self-management. But if you are living with a health condition that suppresses your immune system and you work in a retail service environment where you're customer facing, you may feel more pressure to talk about your health condition to avoid risks associated with COVID-19. So really it's the work environment that plays a big role. Similarly, if your workplace is offering work from home arrangements, maybe the perceived cost of flexibility needed to sustain your employment could be addressed because now again, you can make these changes. But if you're working in a food manufacturing plant, maybe the perceived cost of accommodating could maintain itself or maybe even be higher. So overall, the COVID-19 pandemic has really created new challenges and opportunities for supporting people with disabilities that really do need to be examined further. And so this is just a teaser to this broader discussion that we're hoping to have in this presentation. But before I go, I thought I'd just plug some research that we're conducting at the Institute for Work and Health, which is a very large national program of research which aims at accommodating and supporting communication practices for people with episodic health conditions. And many of the applied insights and tools that we're currently developing are based on some of this evidence that I've just presented and are directly related to research and practice in a COVID-19 work environment. So thank you so much, and I look forward to the conversation, and I'll hand it over to Steve.
Excellent, thank you so much. And Steve, we're ready for you, thanks.
Well, thanks so much, Maureen, and also to Lucy and Eric. Sure appreciate it. I feel like I'm pretty much in line with what they've shared so far as well. My main message is that there are two key factors in accommodating disabilities in the workplace and creating inclusive workplace environments and societies. And those are both control and communication. And as I go through my presentation, we'll kind of touch on that a little bit. And you know, both of these are two-way streets. I'm not able to both individually control all my workplace issues or the communication that happens. It's a two-way piece. But before we think about the individual and what they're facing, it's good to go back again and look at the big picture. And we saw some numbers Maureen shared at the beginning that with the pandemic, 12.4% of the workers were laid off. Well, Stats Canada did a little survey back in June and July of this year. And I would encourage folks to check that out. It's called Impacts of COVID-19 on Persons with Disabilities. And I'm just going to touch on some of the information they shared. So one of their headlines is over 1/3 of participants with long-term conditions or disabilities report experiencing a temporary or permanent job loss or reduced hours during the pandemic. Okay, so that's like 34% compared to 12.4%. We also know right from the start that people with disabilities also have a much harder time getting into the workforce in the first place. That the rate of employment or unemployment for people with disabilities is like twice what it is for the rest of the population. They also, in the kind of the headlines from this Stats Can report that came out in August, they mentioned the majority of employed participants with long-term conditions or disabilities report working from home. As Lucy talked about, this can be a good thing. It can give you more control over how you set up your workplace, how and when you do your work, and gives you more flexibility and control. The next big headline was almost half of participants have relied exclusively on non-employment income since March. And what that means is that people are going to be in poverty. Like any or all of the different social programs we have, no matter which one of the programs, if that's your sole source of income, you're going to be living in poverty. And another headline, almost 1/3 of participants report that their household income decreased since the start of the pandemic, and the ability to meet food and grocery needs and the needs for personal protective equipment are the most commonly reported impacts of the pandemic. So this session is about returning to work during the pandemic or after the pandemic. Well, what we know is poverty is one of those huge, big barriers to entering or going back into the workplace. When you don't have enough money to cover your basic needs, then it's hard to kind of deal with the rest of the world, both physically and emotionally. And it also mentioned in this Stats Can report that over half of the participants have difficulty meeting at least one financial obligation or essential need. And that if you have more than one condition or disability, that number increases. We also know that when you have a more serious or significant disability, your chances of being employed really diminish considerably. When we look at those employment numbers, we see that those folks that have minor or less impactful disabilities almost have the same experience with the rest of the population. But as those disabilities become more severe and more visible, more and more barriers pop up. It's important to also recognize that the survey that Stats Can did had some limitations. And they talk about that. They talk about that the survey was only electronic, it was done online. So if you don't have a computer or access to the internet, you weren't participating. Well, we also know that those folks in the deeper poverty generally don't have access to internet and computers, so that if this was a more representative sample, we might anticipate that those numbers are even worse. They also, at the end of their article, they kind of lay out who participated in this study. 21% indicated they had a sensory difficulty. 38% reported a physical difficulty. 25% indicated a cognitive difficulty. 48% reported a mental health related difficulty, and 57% indicated they had some other health problem. And respondents could select more than one difficulty type. So the part here that I think is really important is that 48% reported a mental health related difficulty. We know certainly from the research that's been done with injured and disabled workers is that once you've been through the system, here you were whole before, you got hurt, you have a permanent impairment, a permanent disability, you have about a 50-50 chance of maintaining both your employment and your mental health. About 45% of participants with that permanent impairment talked about having mental health challenges. And that really compounds the whole issue of communication and control. Communication becomes much more difficult if you're not feeling good, if you're not feeling strong. Also, of course, what we see clearly is stigma is rampant, both in society and in our workplaces. You know, so many people start out with the assumption is that if you have a disability, you're just not going to measure up. You're not going to be able to do those jobs. And then folks that have a disability, when you look at the breakdown of what kind of jobs they have, a lot of them end up in precarious employment where they don't have security, they don't have benefits, they oftentimes don't have good management that knows about inclusive or is committed to an inclusive society or inclusive workplace. So there's barriers galore. Poverty and mental health are two big ones that really make it much harder to both exert control, because having economic resources is part of having control, and it also creates barriers to that communication. I think that in order to really have those inclusive workplaces, we really have to look at work organization in terms of how does the work get done and who controls that and who has the say. Accommodating a worker is one of those factors that allow individuals with disabilities to have a little bit more control over their work. You know, human rights legislation says that you need to be accommodated up into the point of undue hardship. Other folks in the workplace don't have that kind of extra benefit. Of course, even so, we still see high rates of unemployment among people with disabilities. So as we then enter into that kind of going back to work, I think it's important as well that there's some real opportunities to be thinking about and linking prevention of injury and disability along with rehabilitation and accommodation. In a way, we as people with disabilities are like the canary in the coal mine. We oftentimes are the ones that have those negative impacts of the workplace. We experience them first because we already have some vulnerabilities, whether that's a physical or a psychological or psychosocial impact. We're oftentimes the ones that feel it first, and it can be visualized and seen. So if we're able to say, hey, look, there's a risk here. I'm the first one who is experiencing it, but I'm not the only one that experiences it. Can we actually take corrective action now? Unfortunately, oftentimes it's, oh, you're the weak link, and see, this is why I didn't want to hire you in the first place, because you're the one that gets hurt first, or feels that repetitive strain, or is taken by some of those toxic factors. My vision, my real hope going forward is that we're able to say, hey, if we can accommodate people with disabilities, if we can look at how the work is done and say, what are your strengths? What are your weaknesses? How can we help you? And how can I participate in a way where I am more productive? because of how the work is structured. If we can introduce that in a meaningful way into our workplaces and then spread it to everybody, I think we can see people with disabilities as leaders rather than the charity cases we are seeing so often in society, that we're leaders in creating workplace environments that really look to how everybody can contribute in the most meaningful way. Thank you so much for this, and look forward to the questions and answers time.
This is just great. Thank you so much, Steve, and Dr. Coatsum and Dr. Yetta as well. So we do have some questions for all of you. And I just have to say I was very inspired by a lot of the things that you said, you know, Dr. Coatsum, when you were talking about focusing on the tasks, which is such an important thing, but also ask the person, right? We talk about that a lot, ask the person. Of course, that Arif, with your presentation, I was shocked when you presented that stat that the needs have not been needs that have not been met, so accommodation needs that have not been met, have increased by more than 20% post-COVID. That's huge. And of course, Steve, control and communication, right? Like it's key. And being canaries in the coal mine, you know, I could listen to you speak about this all day. So, but we do have a few questions. The first one is to Dr. Coatsum. Can you give some examples of online communication challenges that came up often in your study?
Thanks for that. That's a really great question. So to preface my answer, I'll say that the study is ongoing and the results I presented were really preliminary. So just, you know, just a few quotes so far. But I will say from, Maureen, could you either read the question again or clarify for me, is this communication in terms of interpersonal or in terms of technology mediated?
I would think it would be around interpersonal, most likely, but I think that it's up to your interpretation.
Right, yeah. So what I was saying about people not being at their best, you know, I think most of us, and the you know, just the sheer demand on mental health services right now, and the response. The fact that now we can actually access, you know, some mental health services is an indication that really, as a nation, as a nation of workers, as a nation, we are stressed, and the challenges that arise is, you know, we psychologically become very reactive, and when you have a reactive manager and a reactive worker, you know, both trying to get their job done, both of their identities tied into getting the job done, you know, but now having all the different barriers, either, you know, the technology in the way, or just the assumptions or the attitudes or the prejudice in the way. These are, I can say anecdotally, there's probably not one conversation that I've had either with my networks in national and provincial and local disability organizations. There hasn't been one conversation I've had that hasn't involved that mention of those challenges.
Yeah.
Yeah, so I hope I answered. I'm not evading your question. No. Just as Arif was saying, really the data we're you know, we're in the midst of collecting, and I do have to say, on a kind of a personal barrier front, you know, I'm a person with a disability, navigating parenthood while getting my work done, and for me, I would have loved to have. I would have had this data for you 3 months ago, but I didn't, because I couldn't, because simply too many competing demands. So we don't know yet, but it's we don't have all that data yet, but it's coming. And the more people provide that data, the more people give us this rich information that they're experiencing right now, the more we'll be able to give back to you.
It's a very good point. Thank you very much. This is to Arif, Dr. Jetta. It's a very specific question.
Okay.
If you happen to hire a short-term or an 8-week employee, like specifically only for 8 weeks, under under Canada Summer Jobs, under COVID-19 conditions, to work out of their home, and you find that that one person you hired does not grasp the expectations, but yet they have not declared a disability. So therefore, you don't know how to help them deliver this, like you don't know how to help them in this short period of time. So you've approached to them, like this person is saying, you've approached them to offer support, which they refuse and get offended from the offer. Now what do you do?
Well, I don't know if my research can touch on that, but I think this becomes more of a conversation that Steve actually led to, which is the importance of communication and creating a work environment that is conducive to someone feeling confident and comfortable in bringing up your needs, right? Or their needs, sorry. And I think Lucy also brought this to the forefront as well, is that there needs to be an environment where someone can come to a manager, as well as where the manager can continue to touch base with the employee about how they're doing. And I think all my managers I've been lucky have kind of brought that level of support to me, and I think that's been pretty helpful. So I think that just seems like a communication challenge that I think we all need to be aware of as managers, as well as being employees. And I don't know, Steve, maybe you can elaborate on that, given that this was like the focal point of your conversation.
Yeah, thanks, Eric. Communication is so key, whether any of the people have disabilities or not. And if your communication isn't working, it's time to think about, how can I do it differently? I had one of my managers, I was also a manager, but he was my supervisor, said, you know, people can only handle one negative thing at a time. So if you're giving feedback, give some positive feedback, slip that negative one in, but end with positive. As Lucy talked about, if you start getting anxious and all worried about it, that impedes your communication as well. So really laying out, here's my expectations. Do you think you can meet those expectations? And is there anything I can do, you know, or we can do together to adjust that to make it a good fit? Because ultimately, as a manager, that's what you want. You want a good fit between what a person feels they can do and what your expectations are, and then making that really clear, and then you know, coming back to that if there are issues.
And can I add to this as well? And I think the question also asked about the person not feeling comfortable and talking about their health condition or their disabling health condition. And I think that's their right, right? People aren't entitled to disclose. And in fact, it's obviously a very personal and challenging decision one makes. And that's especially true for young people at the beginning of their career, because there's obviously this fear that if they talk about their health, maybe they'll lose opportunities. Maybe the next year when the summer jobs pop up again, the employer might not want to hire them back. So there's this fear that many young people have, right? And so I think, again, it goes back to the importance of training supervisors, training management, training staff on best practices in communication. And I do think that we are not there yet. I think a lot of employers don't know how to touch on some of these subjects, especially when it's an invisible condition, a mental health condition, something that they're not accustomed to being around or having experience with. And I think that's kind of us as researchers, as community groups, as people who have expertise. It's up to us to kind of get this message out a little bit more and create tools that employers can easily access and utilize in different contexts. And that summer jobs example is one that's quite challenging for many employers.
Yeah. Good, thank you. Lucy, is there anything that you'd like to add to that?
No, I think the notion of communication was well made, and also, you know, not to assume. I'm not 100% sure of the context of the question. I guess the employer, without the employee disclosing something, I guess there was an assumption on the employer's part that there was a disability. I'm not sure. That wasn't super clear to me, but I think yeah, I think all the points were made. Sticking to the task, you know, listing out. Sometimes, you know, I'll tell you, these sometimes temporary contracts or temporary jobs or internships, they can be kind of the worst sometimes, because you know, an intern comes in and people are scrambling. Management sometimes is scrambling to figure out, okay, what can they, you know, what will we have them do? Best thing to do is to you know, prepare a description in the task. What is it that what you really need from this person, and then discuss those clearly. I think sometimes the lack of clarity on the job role, and that goes for everybody, people with disabilities and not.
Thank you.
Yeah, and I think, sorry, just to add to that as well, like I think everyone's kind of going through some level of like impairment right now, because a lot of people are down. So I think it's also safe to assume in your conversations with all employees, this idea of like universal design, like approach your conversations in that manner as well. And I think that might be helpful.
Yeah, it's a good point. And Arif, I just wanted to add on to your point earlier when you were saying, especially if the workers are young and they don't want to disclose their disability. And you know, we started off the session with a slide from Stats Canada that showed that the population that got laid off first were young people. Yeah. So so the fears are not, it's not a conspiracy theory, is it? Their fears are based in some stats and some facts. So I think we've got time for one more question, although it's a big one. First of all, the amazing stats from Steve, we've been asked to put that on some kind of a document. That would be very useful. So I'm sure that the Institute will be happy to do that, and push it out with the rest of the information that is that's being presented today. And so, but the question here is to Steve Mantis, one of the key factors to accommodation is control. So can you expand on that and what you mean by that? And I've got my eye on the time. We've only got about another minute and a half.
Yeah, thanks, Maureen, and thanks for the question. Control is like I mentioned earlier, is really a two-way or more than a two-way street. To be able to say, this is what we need to do. We need to produce so many widgets. We need to be able to handle so many files, whatever it is. How are we going to do that? Really, if we have a team of 3 people, they're going to work on that. If you're able to sit down and talk about it and say, hey, I'm really good at starting it, you know, but I'm not very good at completing it. And then the next person says, hey, that's my strength. Okay, can we work together around that? So having an open discussion about what is it we have to achieve and what are your strengths in order to make that happen. The communication and control then work together. If then, as the manager, you're able to say, okay, let's organize our work around those strengths, then away we go. Oftentimes, managers go, it's my way or the highway, either do it or don't, or get out. And that's where that kind of falls down. So sharing that control with your workers, I think really makes a big difference.
Excellent.
And research corroborates that. Job control, one of the main factors in productivity, in work satisfaction. It's good for everybody.
Excellent. Well, thank you all so very much. This has been an extremely informative session. I've learned a lot myself. I'm going to pass it back over to Yusra now for the wrap up. But thank you very much for allowing me to be part of this really great panel today.
Yeah, Thank you, Maureen. Thank you for the great moderation of this webinar and your insight. And thank you so much, Lucy, Arif, and Steve, for your time, for sharing your expertise, and for this much needed knowledge translation, the conversation around the return to work for people with disabilities in the context of the pandemic is crucial, as well as the importance of improving and establishing a strong and efficient communication. So thank you all for being with us online. And to our audience, thank you for your participation and continued support. The recording of this webinar will be available on our website along with the slides. If you're a WWI member or a VRA Canada member, you receive free certificates of attendance. Otherwise, there's a $15 administration fee. Immediately following this session, you will be directed to the evaluation survey. We greatly appreciate your input on our webinars as well as suggestions for future topic areas. Don't forget to visit our website at workwellnessinstitute.org and stay tuned for upcoming webinar. All of our live webinars are accessible to the public. Thank you so much for your participation. Stay safe and take care of yourselves. Bye-bye.
Bye-bye.